It's Jason Emer in West Hollywood, and we have a celebrity in the house today. We have a very famous acne scarring cosmetic dermatologist from Australia, where actually my best friend is from. I'll talk to you about it in a second. He's very famous over there. Today, want to introduce yourself to everybody?
Yeah, guys, hi, Dr. Davin Lin. Look, really honoured to be here with Jason. And Dr. M is one of the most highly respected dermatologists in the United States.
And I'm very excited to have him here because there's not many people that devote the majority of their time to treating scars, pigmentation, burns, and irregularities of the skin in a cosmetic way that most dermatologists are not trained in. When you do your training programs, you're not really trained in how to fix these types of things, and the impact that it has on people is extremely high.
Absolutely, yeah.
Which is actually why I didn't tell you this yet, but people are starting to hear about this. I'm creating a non-for-profit organization. We just did the submission today, actually, for burns and scar patients. Our goal is to have every laser company give all their devices, and my nurses and PAs and myself and other doctors will donate time to treat patients that have had traumatic burns or scars, acne scars, in the United States, hopefully also with the government, which is one of the things we're going to try and do. So patients like him that have severe scars that need numerous treatments over time, and let me explain that to you, numerous treatments. If I went to the gym one time and expected to be a bodybuilder, it's impossible. To improve these types of scars, you have to work the skin out over and over. You have to build collagen over time. You have to resurface, retexture. You have to hit it from every level to make the skin improve itself, and sometimes it's not 100%. You do the best that you can.
Most importantly, treat the actual scar type. Yeah. So when we're looking at ice pick scars, we've got to treat it with TCA cross. If we're looking at boxcar scarring, we've got to treat it in a certain way. Rolling scars, if they're tethered, we've got to subside. So basically, we've got to have Dr. Emer and I've got to have all these particular skill sets, whether it be filling to simple excisions.
Exactly.
The basis of dermatology is what we're taught to do.
Exactly. So certain scars you need to do, like he said, resurfacing, skin care, peels, and lasers, but some require fillers, other simple surgeries.
Simple surgeries, yeah. Absolutely.
And a lot of doctors don't know how to do that. They have one laser or two, and they want to just do a laser for scars, and patients will come in. You're going to feel little pinches all along the hairline. A lot of doctors will come in saying, or a lot of patients will come in saying that they tried this laser and it didn't work. It's because that laser may not have been the best choice for them.
Absolutely.
So here we are today with our patient who's getting nerve blocks, and I posted about this last week. It's very important, and I know this is a little painful. I'm sorry. You're going to feel little pinches, deep breaths, okay? Is the pain management when you're doing stronger laser treatments. I don't really like to put people to sleep for this because I was a trained Mohs surgeon, turned to the left, where we did almost everything awake and little pinches along the hairline. And I think you can do local anesthesia very well. So he has some medicine to relax. We're doing some local injections right now in areas that I know there's going to be some sensitivity when we laser. And then we're going to do more topical and some injections to make it very comfortable. We also even have nitrous gas if you really needed it.
Yeah, very good. What's your favorite topical, by the way?
We have a BLT that I have made.
As well. Yep.
And I know you guys can compound, right?
Yeah, we compound.
I saw your guys' stuff. Yeah. We have a little bit differently here, but my the one that it took me about 10 years to make this numbing cream, and I'm told by almost everybody that has used it that it's pretty fantastic. Although I always find that no matter what, the men with thicker skin are always the worst.
Absolutely, agree with that.
Or maybe it's just men in general, because the women who have had kids or do yoga are totally fine typically. So I don't know what it is. He's doing very, very well. He's taking deep breaths. He's very motivated. And what I'm showing you guys right now, we're numbing all the major nerves. The main nerves run directly above and below the eye, and then all the way down to the side of the mouth. And I'm just doing a large bolus there. There's different ways you can do this. You need lungs. Long, thank you. So now we're going to go into the mouth. Open a little bit for me. Close slightly.
So it's doing a mental nerve block there, guys. So that's why I like to do it as well with that.
It's much easier to do. Now I do a little prep there also. You okay?
Yeah.
Good. So I know it doesn't seem like, is that what?
He's doing a good job.
He's doing great. He's doing really great. He also is very positive. When you're very positive and you're thinking about the end result, go ahead and close a little bit. And you want to get that result. You're going to do whatever you can. It's going to take you to that happy place so that you can get a really good result. So with him, I think the key component here is to talk about two things: the type of scars he has and his skin type. And I think that's the most important thing. That's also why you want to see an expert, because given his background, skin type, ethnicity, it puts him at a very high risk with ablative resurfacing to get pigmentation issues.
Yeah, and if you go too aggressive with things, you can actually be permanent. So you've got to be really careful.
And
not too worried about the PIH because that usually settles down. But if you go too aggressive with this, you get the hypopigmentation, and I've seen it a lot. And that's almost irreversible. So,
yeah, and sometimes you can even sort of thin the skin or damage it in a way where there's rebound blood vessels that grow.
Absolutely.
And even there, it's challenging. Sometimes it's almost like a true burn.
True burn, yeah.
You know? Go ahead and open again. Good. Hold on.
You can tell those patients have had too much in the way of ablative and aggressive lasers because you've got that orange peel look to it.
Yes, exactly. Yeah. So we really need to be safe. So he understands that we're limited by how strong we can go, but he's doing this because he wants to get a big improvement in one treatment, which is what we're going to do. And we're going to combine a few modalities. We're going to do ablative resurfacing plus TCA cross to some ice pick scars or some of the kind of more shallow rolling types of scars. It's okay. They always know to play Coldplay. This way.
Thanks for choosing my favorite band.
And then long term, he's going to need subcision and fillers to fill out some of these more larger, wider, indented scars. So last one I want to show you is the nerve on the side of the face, the zygomatico-temporal facial. It's really important to actually treat this one because the lateral third of the face is affected. There's a lot of heat over here and it hurts with the lasers. So if we do this deeper nerve here, we'll get a little bit more improvement there. Sometimes feels a little strange to people. It looks scary, but it's not. Great. Go ahead and turn to the left for me.
You only use 2% or 1% there?
You know, I always do it the bit largest. I do 2%.
2%, yeah.
I just have never been nervous about the percentage because it's such a small area.
Yeah, absolutely.
Plus, I do tons of liposuction. We do tons of lidocaine.
Lidocaine,
so I never get worried. Yeah. You know. Yeah. But yeah, I mean,
I'll tell you a story of the BLT though.
I want to hear it.
The BLT, as you know, is cardiotoxic. So we had there's been a couple of reported deaths where.
What age group?
Young.
Okay, that's young. I wanted to point that out because the majority of my patients are over 18. But BLT typically, if it was to cause a problem, then lidocaine usually is in younger patients. Yeah. But what happened? Tell me.
So, it's
you're gonna feel a few pinches on the nose. Okay.
So I always keep it in my room because I'm scared for the day when my nurses just grab it and just go, "We really need a quick acting anesthetic," and they don't realize it's the surface area which counts. Mm-hmm. So we've got to limit it by the temperature in this situation. No problem at all.
Just by your nose. Good. One more deep breath in. Breathe all the way out.
Good nerve blocks, dude.
I know I'm a little crazy with the nerve blocks.
Oh, it's just over the top.
The last one is the hardest one, okay? Take a big deep breath in. Breathe all the way out. You're going to feel a little pinch across the nose. Deep breath. Breathe, 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 breathe. Good. Great. So now he's fully nerve blocked, you guys. We did the main central nerves. We did the lateral zygomatico-temporal facial. Did his nose. And if we were to do for facial resurfacing, we would do his eyelids and stuff. But right now, we're just going to focus on letting him rest for about 10 minutes to let the nerve blocks kick in, and then we'll start the treatments. We'll be able to look. He's going to get some more numbing right now, and then we'll go through the treatment plan for his scars.